To for the Health of It Health Matters. I'm your host, Tammy. I apologize for being a little late tonight. My music, of course, decided it didn't want to act right, so I apologize for that. Good evening, everyone. Thanks for joining me tonight. Again, I'm your host, Tammy. Playing in the background is God Bless America. As part of my patriotic theme here. Again, thanks so much for joining me tonight. I certainly hope everyone's having a great Saturday night so far. Again, thanks for joining me. Please tell somebody about my podcast. Just say, hey, I'm listening to a live podcast. Maybe you wouldn't mind joining me. Say I'm listening to a live podcast. Maybe you wouldn't mind joining me. Or if you listen to the downloaded podcast, thanks so much for listening to the downloaded podcast. Again, I greatly appreciate it. I also have another podcast. It's called The Nation Podcast. It comes on Wednesday nights on Spreaker.com. That's The Nation Podcast on Wednesday nights on Spreaker.com. In the same time slot, 8 o'clock Central, 9 o'clock Eastern, 6 o'clock Pacific, again on Spreaker.com, and that's again The Nation Podcast on Wednesday nights. All right, let me just cue up this my phone here. Try to set it up so I can look at the audience, and rather than looking down. All right, let's see. I think I do better by shooting my phone up here. All right. Again, thanks so much for joining me tonight. Again, I really do appreciate it. All right. Let me see if we can go to some headlines here. Tell you what I'm gonna do. Let's see, because I need to have my phone next to me, as I said, so I won't be constantly looking down at it. I'm trying to do it this way, so I won't be constantly looking down at it. Also, by the way, I am coming to you from my. Let me move this over just a little bit. Coming to you from my channel, America's channel. The A stands for action. The M stands for motivation. The E is for energy. The R is for responsibility. The I is for initiative. The C is for core and care. And the A is for all, as in liberty and justice for all. And so, again, I certainly hope that someone will join me. I said, I'm laughing about it. I'm saying that's just like technology. It's great, except when you're trying to get it to work the way you want it to work, and then it decides it doesn't want to. Okay, how about that? All right, let me get to some of these news headlines. All right, and on next Saturday, I'll make sure my music is up. All right. Let's see, we're gonna go to wait a minute. Let me go here real quick. All right. Okay. Let's see. All right. Excuse me for just a second. Okay. Gonna look at this headline now. I try to find, stories, of course, that are that are interesting, to everyone, so that we'll have enough to talk about. Now it says monkeypox eradication unlikely in the U.S. as virus could spread indefinitely. So it doesn't look like we're going to be getting rid of monkeypox anytime soon. I don't know if that's a good thing or, well, I guess it's not a good thing for the people who have it, I guess. But I'm certainly hoping that, we'll have we will have some kind of solution to the problem. That's all we can hope for at this point, is that we'll have a solution to the problem eventually. I mean, COVID has slowed down, a lot. So we're hoping that we'll that just like everything else, we'll find a cure, and then we will move forward from there. Now, this article says some hospitals rake in high profits while their patients are loaded with medical debt. Man, I'm going to tell you something. As a person who had 2 surgeries within months of each other, I mean, I don't know how anybody affords it. I don't, because I had medical debt myself. And so I had to go and I had to ask the hospital where I work for help, because I couldn't even pay off the debt. I mean, it was like about $10,000 for the first one. And I can't remember how much the second one was. But I can tell you, I mean, it was terrible. And I thought, boy, I said, how am I ever going to pay this back? Because, I mean, I didn't have the money to pay. I didn't have thousands of dollars to pay. Now, the first surgery I was told I needed to have, it was cataract surgery on my right eye. And so I went to my eye doctor, and I was told to have cataract surgery. Okay? I did that. But as I said, and I have insurance, but my insurance didn't cover a lot of it, because they're only going to cover so much. And so it's crazy how much it costs. I don't know how anybody can afford to be sick. And then the second surgery, I had a fell and broke a bone, my wrist, my radius bone. So I had to have surgery, and that was thousands of dollars. And as I said, I don't know how anybody affords it. I don't. I really, really don't. Just the medicine alone. And I said, and people have to take, and there are people who have to take medicine all the time. And it's like, how do people afford it? And I get it. There's insurance, there's Medicaid, there's Medicare. I get it. But it is just so very, very expensive to be sick. I mean, it's just the truth. I'm and again, I realize that, we have to have hospitals and we have to have doctors. I get it. 100%. But, again, it is very, very expensive to be sick. And that's why I'm doing everything I can to try to keep myself as healthy as possible, because it's like, Father in heaven, it's just so very expensive. So, this one says, some hospitals rake in high profits while the patients are loaded with medical debt. And it says some hospitals around the U.S. are seeing high profits, even as their bills force patients into debt. Of the nation's 20 most populous counties, none has a higher concentration of medical debt than one particular state. And so I'm going to leave the name of the state out. But these people have a whole lot of medical debt. Almost everything about the opening of when they're talking about football game was big. And it says, it goes on to talk about the fireworks and all that. And so it talks about the team's new stadium and all that. And then it talks about healthcare hospital that was that I guess was one of the sponsors of a $53 million with the largest college stadium with the largest video screen says of any school venue. Business has been good for the $1 billion pediatric hospital system, which agreed to pay $2.5 million to put its name on Prosper Stadium. Other Dallas-Fort Worth, and this is talking about Dallas, have also thrived. Though exempt from taxes as a nonprofit, institutions including children, double-digit margin in recent years, outperforming many of the area's Fortune 500 companies. But patients aren't sharing, it says, in the good times. Of the nation's 20 most populous counties, none has a higher concentration of medical debt, and the name's the county. It says credit bureau data show the mismatched fortunes of hospitals and their patients reach well beyond this corner. Nationwide, many hospitals have grown wealthy. And again, I work in a hospital, so I'm not, reading this article simply because, I'm trying to criticize a hospital. But here it is right here. The mismatched fortunes of hospitals and their patients reach well beyond this corner of Texas. I'll say Texas. Nationwide, many hospitals have grown wealthy, spending lavishly, on advertising, teams, sponsorship, and even spas, while patients are squeezed by skyrocketing medical prices and rising deductibles. A KHN review of hospital finances in the country's 306 hospital markets found that several of the most profitable markets also have some of the highest levels of patient debt. And I believe it. Overall, about a third of the 100 million adults in the U.S. with health care debt owe money for hospitalization, according to a poll conducted by KFF, I don't know who that is, for this project. Close to half of those owe at least $5,000, about a quarter owe $10,000 or more. Again, like I said, my medical debt on the first operation was like, the operation itself was like 10, and each one of I was charged, or my insurance was charged for each one of the different procedures that happened to me. The stitches, the anesthesia, there was a separate charge for everything. It says about a quarter owe $10,000 or more. Many are pursued by collectors when they can't pay their bills or hospitals sell the debt. The fact is, if you walk into a hospital today, chances you going to walk out with debt. Again, people need to go to hospitals, but it says you're going to walk out with debt, even if you have insurance. Hello, like I said, I have insurance. Says Allison Sesso, Chief Executive of RIP Medical Debt, a nonprofit that buys debt from hospitals and debt collectors so patients won't have to pay it. And so, of course, again, that's probably what happened to me also, because I couldn't pay it. If anybody, is a witness to that, you can come on, and say, hey, I'm a witness to that. A community shadowed by debt. And it says, across the Dallas-Fort Worth metro area, the nation's fourth largest, impact has been devastating. Medical debt is forcing people here to make incredibly agonizing choices, said Toby Savage, direct program director at Pathfinders, a Fort Worth nonprofit that assists people with credit problems. Savage estimated that at least half their clients have medical debt. Many are scrimping on food, neglecting rent, and even end up homeless. And this is just not low-income people. Yeah. Again, it is no joke. The medical debt is no joke. David Ziprich, a Fort Worth businessman and grandfather, was forced out of retirement. This was a grandfather and a businessman. after hospitalization left him owing more than $200,000. $200,000. Zipprich, 64, has spent a career in financial consulting. He owned a small bungalow in a historical neighborhood near the Fort Worth rail yards. His daughters, both teachers, and 4 grandchildren lived nearby. He had health insurance and some savings, and he paid off his mortgage. So by all accounts, this man was doing well. Doing well. Then in early 2020, it says Zipprich landed in the hospital. While driving, his blood sugar dropped precipitously, causing him to black out and crash his car. After 3 months later, after he was diagnosed with diabetes and other complications, led to another hospitalization. December 2020, COVID-19 put him there yet again. I look back at that year and feel lucky I survived, Zipprich said. But think about all the medical debt that's piling on. Now, this man's retired. He ain't working a full-time job no more. And all this debt. And what's he supposed to do? Social Security sure ain't going to handle it unless you are really, really well off and have thousands of dollars and you don't have to worry about it. Again, you're in a deep hole. But even with insurance, it says Zipprich was inundated with debt notices and calls from collector. His score plummeted below 600, and he had to refinance his home. Isn't that something? I can't even imagine. He was doing well. Didn't have any kind of, debt like that. Fortunately, he was hospitalized and had to go in debt. My stress is off the charts, he said, sitting in his neatly kept living room with his dog. Overall, in Tarrant County, 27% of residents with credit reports have medical debt on their records. Credit Bureau data analyzed by KHN, a nonprofit urban institute, shows in Dallas is 22%, Dallas County. That's more than 5 times the rate in the largest county in New York. Data shows the Texans owe a lot more. The median amount of medical debt and credit records in Tarrant and Dallas counties is nearly $1,000 compared with $400 less in New York. Yeah, my goodness. And I don't know why it's like that. It's got to be a reason for it. Because they're not the only ones in medical debt. I know they're not. Bachelor Zipprich returned to work, taking a job in New Jersey. Now, this man's in Texas, and he had to go to New Jersey and go to work. New Jersey, a couple of thousand miles away, cold winters. And he had to go back to work and fly back and forth from Jersey to Texas, Texas to Jersey. Can you believe that? Wow. He recently quit, citing the strain of so much travel, of course. It's so sad to see this, to hear this, or read this. It's so sad. He says he recently quit, citing the strain of so much travel. He's now job hunting again. Never thought this would happen to me, he said. And I'm not trying to depress anybody. I'm not trying to be a downer. I'm really not. But, this is just one man's story of medical debt, how he was retired. Had to go back to work because he got sick. Now, I'm not an advocate for free health care and all. I'm not an advocate of that. But what I am an advocate of is just the cost of health care. And the fact that to me, a lot of it is unfortunately, it's just. It is, to me, comes a burden, obviously. But to me, there's something else that should be done about this. It really is. Why does it cost so much? That's my question. Why does it cost so much? Why did this man that I'm reading about have to go come out of retirement and have to go to New Jersey, for heaven's sake, to work. 64 years old. He had retired. I cannot stress that enough. Imagine yourself if you retired and then you had to go back to work. And I mean, I'm not saying that he's the only one, but you get the point. Now he's had to go back to work. He quit the job that he had because New Jersey, from Texas to New Jersey. And he quit. Now he's looking for a job again at 64 years old. I feel bad for him, and I pray that this man is going to be able to find work that he can, so that he can survive. That's what I'm praying for. Who is responsible? Even small debts can have potentially dangerous consequences. Discouraging patients from seeking needed care. That's right. A lot of people won't even go. They won't go because they're saying the heck with it. I can't afford it. I can. This is just one man's story, but there's many more of him out there. Please believe me, there are many more of this man out there. Discouraging people from seeking needed care. People they say, I can't afford it. Angie Johnson, a 28-year-old school teacher, cut short her honeymoon so that she and her husband could pay off more than $1,100 she owed a physical therapy center. So she couldn't even take her whole honeymoon because she needed to pay these people back. Which again, she did what she had to do, and I applaud her for that. I understand that. By Baylor Scott and White, this is a Mammoth, Dallas-based hospital system. And again, I know they're not the only ones. Johnson said the center where she'd gone after a knee injury, and I went to therapy. And of course, that costs money too. Initially said her business cost will cost $60. $60. But they billed me hundreds, so that means she was lied to. And so where can this lady go to have that debt reduced? Where can she go to end that? So I don't go to the doctor unless I absolutely have to because it's so expensive. And I said, same thing. I don't either. I have insurance. Again, this man, thousands of dollars in debt. And this lady's a school teacher. Hospital industry leaders blame the patient debt on health insurers. Okay, here we go, with the blame game, right? Citing the rise of high deductible plans and other efforts that limit coverage. The last thing that hospitals want for the patient to face financial barriers. Well, they are. It might be the last thing you want, but they are. Said Molly Smith, who leads public policy at the American Hospital Association. So everybody blaming everybody. Hospitals are in there trying to work on behalf of patients. And I won't say it's completely bad because you have the hospitals that are trying. Again, they help me because I couldn't pay off my medical debt. So they help me. So I'm not saying that they don't help people. But the question is, why is it so darn expensive? Why is it that this is like a concierge service where you have to pay for every little thing? Every little thing. That's my question. It's concierge medicine where you bill for everything. Despite repeated requests from KHN, none of the medical systems around Dallas-Fort Worth would discuss their finances or debt carried by patients. Oh, of course they're not going to talk about it. They certainly don't want to. But Smith and other hospital leaders point to billions of dollars of free or discounted care that hospitals nationwide provide every year. Hospitals have been pretty darn generous, said Stephen Love, president of the Dallas-Fort Worth Hospital Council. If other parts of the community did such as hospitals, we wouldn't be in this problem. Unlike drug companies, device makers, and many physician practices, most U.S. hospitals are nonprofit, and that's true. Must provide charity care as a condition of their tax-exempt status. And that's true because I work for a nonprofit. Okay? Regards to tax status, medical centers and markets with high medical debt do provide more charity care, according to an analysis by KHN and the Urban Institute, a Washington think tank. That's important, says Dr. Vikas Saini, president of the Lown Institute, a nonprofit that grades hospitals on their quality and community benefits. But Saini asks, does the hospital truly serve its community if it's pushing so many into debt? And I asked the same question. Because yes, you can blame it on the insurance and the insurance blame it on the hospital. But again, something's wrong when patients are pushed into thousands of dollars worth of debt. Oftentimes just for simple procedures. Simple procedures. Around Dallas-Fort Worth, major medical systems frequently top their commitment to the region and its patients. Well, West Texas Health Resources, a Dallas-based nonprofit system with more than $5 billion in annual revenue, opened a new hospital town in Fort Worth earlier this year. Barclay Burdan, the system chief executive, said the building reinforces Texas Health's longstanding commitment to the Fort Worth community. The 9-story, $300 million tower is one of more than half dozen new hospitals and major expansions around the Dallas-Fort Worth area since 2018. So, I mean, all the hospitals that have been built, and the hospital I work for has a lot of hospitals too. And so the money's going someplace. Not if it ain't going to the patient. So again, there's enough blame to go around. And so again, you have, as I said, all the hospitals. The operating margin for a lot of the hospitals it has here. The big building spree has been accompanied by big bottom lines. From 2018 to 2021, Texas Health, which owns hospitals in North Texas, had an average operating margin of almost 6%, according to a KHN analysis of publicly available financial reports. Other major systems in the area included Baylor, Children's Health HCA, the nation's largest for-profit hospital company, did even better, KHN found. Cook Children's, the region's second major pediatric system, had an average operating margin of nearly 12%. By comparison, profits at the most of the 25 Fortune 500 companies based around Dallas-Fort Worth, and talks about some of the other companies, were less than 6%. So, somebody making some money. Hospitals have thrived in other markets with high patient debt. KHN found Charlotte, where a quarter of residents have medical debt on their credit reports. Hospitals report an average operating margin of 13.6%. The average margin of hospitals in and around Gainesville and Lakeland, two Central Florida markets where a quarter of residents also carry medical debt, top 9%. Tulsa, Oklahoma, which had the same level of debt, margins have averaged 8.5%. And it says which large counties have the worst debt problems. And so they talked about some of the different places: New York, California, states in other counties in other states, and Texas. So, yep, a lot of New York and California and Texas. Overall, U.S. hospitals recorded the most profitable year on record in 2019 with an aggregating operating margin of 6.5%. According to the Medical Betterfare Payment Advisor Commission, total margins, which include income from investments, were even higher. You might think the hospitals and communities where patients have a lot of debt would be less profitable, but that doesn't seem to be the case. Says Anuj, and I won't pronounce his last name because it's too long, a senior Urban Institute researcher who worked with KHN on an analysis of hospital finance and consumer debt data in U.S. hospital markets. And so it says, again, in hospitals and communities where patients have a lot of debt, you would think it would be less profitable. But again, that's not true. And the analysis found there is no apparent relationship between the profits of hospitals and market and how much medical debt residents have. So while hospitals in places like Charlotte and Tulsa might be comfortably in the black, In other places with high patient debt, hospitals are struggling, it says. Industry experts say the most profitable medical centers, like those around Dallas-Fort Worth, have developed business models that allow them to prosper, even if their patients can't pay. One key is prices. And what did I say about concierge medicine? These hospitals maximize what they charge for everything, the big and the small. So it's like, okay, just a small thing will cost you hundreds of dollars, and you understand that those dollars add up. From complex surgery to a dose of aspirin, most of these charges are picked up by health insurance, which still pay a much larger share of hospital bills than patients do, even those with the highest deductible. Across the country, many medical systems have strengthened their market power in recent years by consolidating, buying up smaller hospitals and physician practices, which my hospital has, and which enable the hospital system to charge even more. It says Dallas-Fort Worth has the highest medical price in Texas, according to the Health Care Cost Institute, a nonprofit that tracks costs nationwide. In the state where most markets have relatively low medical prices, inpatient care, it says that Dallas-Fort Worth hospitals are 13% more expensive than the national median in 2020. In addition to charging more, the most profitable hospitals frequently squeeze more savings from their operations, holding down what they pay workers, for example, and securing better contracts from suppliers. And we have a lot of contract people that work there. Hospitals have had to get leaner and meaner, says Kevin Holleran, a senior director of Fitch Ratings who tracks nonprofit health systems for the bond rating firm. It's unclear how much longer this business model can endure. Across the country, many small and rural hospitals have closed. That's right. Even some larger systems are now losing money as inflation and rising labor costs put new pressure on bottom line. And frankly, the hospital I work in, they're saying that they're having a lot of budget problems. So I just pray I'll still have a job, in next year. As bills rise, hospitals are having a harder time collecting. Last year, nearly 1 in 5 patient bills generated by hospitals with people with insurance topped 7,500. According to analysis of hospital billing records by Crowe LLP, a Chicago-based accounting and consulting firm that was more than triple the rate in 2018. Yeah, you got a lot of middle class and poor people who can't pay. They can't pay these medical bills. They need medical care, but they can't pay the bills. These are bills that fewer and fewer patients out there can afford. Like I said, what did I say a minute ago? Said Brian Sanderson, a senior Crowe health consultant and former hospital executive. Indeed, hospitals manage to collect less than 17% of patient balances that exceed $7,500, according to Crowe's analysis. The rate at which patient balances are growing is just unsustainable for our health system, Sanderson said, predicting that most will never be able to collect bills absolutely of this size is trending to the ridiculous. People can't afford it. As medical care goes up, people still need medical help, but they can't afford to pay the bills. Bills are getting more, the hospital bills are getting more expensive, but people can't afford it. They're poor. They're middle class. They're struggling to put food on the table. They have to have an operation, emergency or non. And they can't afford to pay it. Robert Early, a former Texas state legislator who used to head Fort Worth's public health system, compared today's hospital to shrimpers in the Gulf Coast district he once represented. They wanted to pull so much shrimp out of the bay that they didn't think about whether there'd be any long-term consequences. I worry that those of us in healthcare aren't asking ourselves enough if the system is sustainable. Absolutely. That's right. So this is from Diagnosis Debt. I guess KHN is a news service, or Kaiser Health News. KHN is Kaiser Hospital in California Health News Service. And so again, you have to ask yourself that question. You do. You have to ask that. Is it sustainable? And there's some of the comments here. It says, have you ever looked at basically any HCA hospital? A bag of saline is what, 12 cents? they charge insurance $1,000. He said, this other person says they charge my insurance $1,000 for blood work that the insurance paid $3 for. For the hospital system then accused the insurance system of paying them. And it's the truth. Nobody's shocked, and nobody is shocked by it. Needs to be healthcare anti-price gouging legislation. It says the local nonprofit hospital is the worst debt collector in the state. The vision to try to extort money from family patients like the children or siblings. They can't even be bothered to be a competent hospital. So again, that's the thing. It's so horrible. It's so awful. The whole hospital care system is a for-profit racket. Gambling the average patient's life is collateral. And so again, it just is. Again, it is unfortunate. It really is. And there's again, there's some stuff that needs to be changed, period. FDA's rotten definition of healthy food is finally getting tossed. For now, salmon and nuts are not eligible for healthy label, but sugary cereals are. Yeah, I know, right? because some of the stuff that they're labeling healthy, you have to wonder about it. And that's why I've been saying since the beginning of this podcast, it's up to you. It's up to you to take care of yourself. Because nobody else is going to. If you're looking for the health food companies to take care of you, forget about it. If you're looking for the food companies to take care of you, forget about it. You better take care of yourself. You better. Because I'm saying you're the only person that you have to rely on. I'm being honest about it. Now, obviously, I'm a Christian person and I rely on God, but understand that God can't do everything. We better start relying on ourselves. Because again, the powers that be out there ain't going to help you. They're in it for themselves. And I mean, COVID taught us that, okay? If COVID didn't teach us anything, it taught us that these people are in it for themselves. All you have to do is look back at what happened. And so you better wake up and realize that these people are in this for themselves. They're not in it for us. And if you don't take care of yourself, then what's going to happen to you? Period. You're going to wind up sick in the hospital or dead. I mean, I'm not trying to be a downer or anybody. I'm just saying. I decided over 2 years ago that the buck stops with me. I'm not waiting for anybody else to take care of me health-wise. I'm not looking for anybody else to take care of me health-wise. Even God can't do everything. And so people better wake up and realize that. I'm reading you some of the headlines here. Our goal is to stay as healthy as we possibly can stay. Do everything you can to stay as healthy as you can. Again, because these people are not going to help you. They're just not. Number of states with high rates of adult obesity more than doubles. Again, nothing surprising there. Because people aren't taking care of themselves the way they should. They haven't been for a very long time. And you're not going to and again, I'm just saying it's not going to get any better. People better take care of themselves. Because you're going to, like I said, the consequences are not going to be very good. And like I said, I made a decision for myself And you better make a decision for yourself too. That's just, again, period. All right, I'm trying to get this article to come up. Let's see. Okay. 19 states and 2 territories have at least 35% of residents with adult obesity, more than doubling the number of states with a high obesity prevalence in 2018. According to the data from the CDC, 2021 adult obesity prevalence maps also highlight the need to address disparities. Well, of course, they're going to talk about that. States, and of course, they're going to talk about that, which, Okay, so we're just going to read adult American Indian or Alaska Native state adults, 31 states. Asian adults, 0. See, because let's face it, they eat healthy. Black adults, 36 states. Again, this is obesity rising in a number of states. It says, which is again in the states that it's rising in is not anything surprising because unfortunately, in the black and brown communities. And I'm not blaming it on racism or anything. I'm saying we are the ones that unfortunately are being caught, and we're the ones that unfortunately again are not taking care of ourselves. Hispanic, 27 states and Guam. White adults, 10 states. And so it says adults with obesity are at an increased risk for many other serious health conditions such as heart disease, stroke, type 2 diabetes, which is, again, not surprising. None of this is surprising. Some cancers, severe outcomes, COVID-19, and poor mental health. And so, again, it's sad. This report illustrates the urgent need for making obesity prevention and treatment accessible to Americans in every state and every community. I get it. I say it. I agree. That there needs to be more. I've said it before. Why is this not a national outcry? Why don't we have commercials about this? Why is this not a priority for us? There's something that needs to be done. Okay? All right. The White House Conference on Hunger, Nutrition, and Health outlines concrete steps the federal government can take to help states and communities reduce this disparity, it says. Well, again, what are they doing? I haven't seen anything. Supporting healthy and individual lifestyle changes. Okay? Ensure that all people have access to healthy foods. Okay? Evidence-based healthcare services, obesity treatment programs, and safe places for physical activity. A lot of people stayed at home and ate, so that's why during COVID, and that's why a lot of people gained weight. Again, we have to do something about it. And they read all the states, and most of them are from the South, some Midwest. And so, we need to figure it out. We need to figure out what we can do, because something else has to happen. It just does. HHS price of more than 1,200 drugs outpaced inflation. What did I talk about a moment ago? The fact that the cost of drugs is going up so much, and people can't afford them. They need them. Some of them have to have them, or they're going to die. But not being able to afford them. Okay. All right, we're going to read one article, another article. Let's see. We're gonna read one article, and I need to find it. Let me see if I can go to this one, if I can find it. Let's see. Okay. All right. Okay. Now, this is from the Harvard Chan School of Nutrition. Bold action needed on U.S. Food policies. It says in advance of the White House Conference on Hunger, Nutrition, and Health, the nutrition experts called upon federal officials to develop smart policies to improve the health of individuals and community, reduce health costs, and protect, and of course, protect planetary health. But the part that got me was reducing health costs. What are we going to do about that? Again, people can't afford it. They can't afford the doctor. They can't afford the medicine. They can't. Okay. So let's see. Okay. Nation faces significant nutrition-related issues, according to the co-authors of this study. Food insecurity says, and obesity, by which I read an article a moment ago on the resulting cost of the healthcare system, labor market, and economy, national security. And so, make nutritious foods accessible to all, protect children from harmful food marketing, strengthen food labeling, commit to a sustainable food system, and improve infrastructure, support active living. Americans deserve food and nutrition policies to make it easier for us all to live full and healthy lives. America's well-being depends on it. And so, again, this is something that needs to be done. It just does. Okay? Just does. Because people are suffering. And what are we doing about it? Okay. I'm trying to bring up this one last this article here, but again, what are we doing about it? How we again, there's got to be some fire lit under a lot of our senators and congressmen to try to do something to tackle this problem. And it talks about the first summit on hunger in more than 50 years. And so it says, why do we need change? And it talks about food insecurity and obesity. More than 30 before the pandemic and recent inflation, more than 38 million Americans lack consistent. It talks about healthy nourishment and obesity, how obesity has gone up. It's more than 2/3 of adults are now overweight or obese, which has contributed, of course, to a much shorter lifespan in the U.S. and other countries with advanced economies. This matters beyond personal suffering. The cost ripple through our healthcare system. Speaking of costs, our labor market and economy, and national security. Only an estimated 2%, 2 in 5 young adults are weight eligible and adequately active to serve in the military. 2%, 2 in 5 young adults. And of course, it goes on to talk about, how people don't have access to fresh fruits and vegetables, etc., etc. And so, and then it talks about, as I said, make it nutritious foods accessible to all. And so they protect children from harmful food marketing. Children are bombarded with advertisements for unhealthy food and drink. Studies show a direct association with increased risk of obesity. Strengthening food label to help consumers make better choices. We need to mandate straightforward science-based labels for packaged foods. Many countries have front-of-package labeling to identify unhealthy foods with added sugar, sodium, fat, and calories. Have seen improved nutritional quality as a result. Comments must require similar action. And I say to turn the package, box, bag, can around. Turn it around and look at it. Turn it around, look at it. Even if it appears to be healthy, even if it looks healthy, even if you've seen it advertised and marketed as healthy, please turn the label around. Turn the can around, the bag, the box, the package. Turn it around, the bottle. Look at it. Look at how much fat it has and look at how much sugar it has in it. Look how, look at the ingredients in it. Look at it. And if you don't understand an ingredient, look it up. I have. Use your phone for something more than just going to social media. Start looking at stuff, research stuff to help yourself. Let's not be ignorant anymore, everybody. Let's not put our heads in the sand anymore. We gotta wake up. A lot of this they're talking about is good, but understand there's got to be a personal responsibility in here. If we take away people's personal responsibility, it's not going to change. It's hard. It's a message that people don't want to hear, but nonetheless, they need to hear it. We can't blame everything on the food companies. We can't blame everything on this, that, and the other. When are we going to step up and take personal responsibility? It's been allowed to happen because we haven't taken personal responsibility. We haven't. Period. End of sentence. Two office conferences, all talk, no action. Yep, it sounds good. Sounds good. But let's do something else. Let's work hard to make sure it happens. I'll vote for any law that will help make things better. But again, just having another conference isn't going to change anything. Again, it's hard, it's harsh, but people have to step up and take more responsibility. They have to. It's not going to happen unless people step up. It just isn't. It just isn't. Okay. All right. Let's see. Okay. Trying to find one more story, one more health news story. Okay. NIH funded study just used GMO mosquitoes to inject a human. I mean, you can't really even make this stuff up. You really can't. This is what the NIH is doing with our tax money because they're a government run agency run by taxes. National Institutes of Health. A study just used GMO mosquitoes to inject a human. Okay. All right. Let's see. Okay. All right. Let me see. Okay. All right. Let me just try to find one last thing here. All right. Okay. Red Cross admits they do not separate vaccinated from unvaccinated blood. Now, why don't they? Mother claims they died of blood clots of donated blood. Well, again, nothing surprising there. All right. But yes, again, like I said, this is something that we have to do something about this. We have to speak up. And again, number one, demand people take responsibility for their actions. But number two, demand that the government do more and make obesity a national health crisis again. And come up with solutions to try to figure it out. Again, the number one thing again is for people to take personal responsibility. That's a message people don't want to hear, but to me, that's number one. Number two is, again, to make it a national health crisis with commercials and everything. Waking people up and helping them find alternatives, to health. to help themselves. All right, everybody. I'm going to end the podcast tonight, but I thank everyone so much for the two people that came on the live chat. Thank you so much for coming on tonight. I really, really again do appreciate you. All right. All right. All right. All right, everybody. Again, thanks so much, as I said, for coming on tonight. I really, really do, as I said, appreciate everyone who tunes in, who listens faithfully. I'm still trying to get people to come on my YouTube channel here, but it's okay. Eventually, we're going to get people to come on. It's just a matter of time. All right, everybody. Thanks so much again for listening tonight. I'm your host, Tammy. Again, thanks so much for coming on. Please tell somebody about the podcast. I would really greatly appreciate you. Just say, hey, I'm listening to a downloaded podcast, and maybe you might be interested in listening to it. I would really, again, appreciate it. Playing in the background is God Bless America. I am Tammy, your host for the Health Matters on Podbean.com, on YouTube Live. Again, tell somebody about it. Watch the video if you'd like. Again, come on my YouTube channel. Tell other people about it. On Wednesday night, The Nation podcast, 8 o'clock Central, 6 o'clock Pacific, 9 o'clock Eastern on Spreaker.com. Wednesday night, The Nation podcast on Spreaker.com on Wednesday night. Again, I'd really greatly appreciate if you join me Wednesday nights. Again, this is America's channel. Action, motivation, energy, responsibility, initiative, core, care, and all. Please come on YouTube and comment. I'm going to keep on asking. Mad McMahon and others who came on, please, come on my YouTube channel. I'd appreciate it. All right, everybody. Again, have a good week. Please take care of yourselves. Again, I do appreciate everyone, as I said, who faithfully comes on and listens and listens. I do appreciate you. Again, take care of yourselves until next Saturday night. This is for the Health Matters. And we will be talking to you next Saturday night. Subscribe to my YouTube channel and do everything you can, as I said, to support me. I would definitely appreciate it. Till next Saturday night, good night.